As we age, we develop lines across the forehead or between the brows. These lines we create even from a very young age when we move, and they're called dynamic lines because we only see them when we're moving, but as we age, even when the face is still, we start seeing these lines just about when we're relaxed as well, so they've now become what we call static lines. So using an injectable treatment, botulinum toxin type A, we can relax these muscles so they can't contract and the area looks smoother. So by placing a few little injection points in this area here, which we call the glabella complex, we relax the muscles that we use to create the frown, and the area looks smoother. You've actually had 2 treatments, and what I've noticed this time is that the vertical lines here have virtually disappeared. The drug has worn off because you've got full movement. If you can demonstrate a frown for me, that's it. The drug has completely worn off, but the area still looks smoother, and we find this with toxin treatments that after repeatedly treating, even when the drug's worn off, the area can look smoother. We're going to inject a series of little points into this muscle, and we use this muscle to lift the brows. If you can lift your brows for me and relax again, and put the muscle into a state of relaxation so it can't contract as easily, and make the area look smoother. We have to use smaller doses here. It's a smaller muscle, and over treating this muscle can result in quite a heavy feeling over the brows, which can be quite tiring. It takes up to 2 to 3 weeks to settle in. For a good few days you won't see any effect and wonder what you've had done. As it does start kicking in, you'll find it harder to frown and tighter across the forehead. You should still be able to lift the brows just slightly, otherwise you risk having a very heavy brow. We're not trying to create a mask, we're trying to create natural smoothness, so people may think you look well or relaxed or fresh, but not heavily treated. We're also going to just put a couple of the smallest dots here just to soften these little laughter lines. We don't want to blank those out completely, and they are very, very small as well, so 2 little small dots there will just soften the area as well. Aftercare, please don't touch the area. Give it a good 3 to 4 hours to avoid any infection from the fingertips, from makeup brushes. Much as those holes are closed, little needle injection points are closed already, bacteria can still trap through for a good few hours. So don't touch, and don't let pets, children make brushes near the area. If you Google aftercare following this treatment, you can find all sorts of myths of things you can't do, which over the years have been proven to be unnecessary. So many years ago, people still ask me this now, should I walk around making facial expressions to help the drug uptake? Completely non-essential, just carry on as normal.